This is my audience.
Show me again.
Alright, you hear about kids being vaccinated and later being diagnosed with autism, and as a parent, that's your biggest fear, is to have your kids sick or something bad happen to them. But is it really the vaccines that cause the autism, or is it just something to blame? Vaccines have positive and negatives, and do the negatives really outweigh the positives? Even though some people are convinced not to vaccinate their kids due to the fear of autism, leaving their child unvaccinated can cause several dangers. Debates in nursing class, listening to nurses discuss this topic, and I've also done research on this topic as well. First, I'll talk about why parents choose not to vaccinate their children, and then I will talk about the dangers of not vaccinating them. And last, I'll talk about what we can do to further educate parents about the importance of vaccination. Within the past few years, more parents have decided to not vaccinate their children due to the fear of autism, which is affecting their ability to enroll in school. The vaccination that is for MMR, which is measles, mumps, and rubella, is thought to be linked to autism, which is why parents aren't getting the vaccination for their children. Dr. Anjali Jain explains in an article from MSNBC that there's no link between the MMR vaccine and autism. But researchers have found that it is genetically linked in some cases, or it can be caused by a change in DNA. Kids with siblings that have autism are at a slightly higher risk, so that is why those parents may choose not to vaccinate their children. The TV and internet can be misleading, which can cause fear for the parents because not all their facts are always true. Autism's signs and symptoms appear the same time as you get your children vaccinated with the MMR, and so that is why they think that the MMR vaccine causes the autism. Schools require vaccinations because they don't want preventable diseases to spread, and some parents are angry about that and they don't want those requirements. Parents say that they should have their own choice as to vaccinate their children, and they should, but they also need to consider the dangers. Choosing not to vaccinate your children comes with several dangers to not only your child but to others. Vaccinations are meant to protect from diseases, and they're meant to protect not only that child but the other children whose parents don't vaccinate them as well. Medical exemptions allow some children not to get vaccines because of their health, according to CNN, but that's only a small number of children. In Florida, there was only 800 as an average. One major concern is refusing to get the MMR vaccine, which I have mentioned before, because those diseases, measles, mumps, and rubella, are very communicable diseases and are very dangerous if you get them. In December of 2014, there was an outbreak of measles in California at Disneyland, and that spread to other states. And according to the CDC, from just since January, there have been 159 cases of measles within 18 states. In California, there's a bill being proposed not to allow unvaccinated children to enroll in school, according to articles on MSNBC, due to the outbreak in California. The hope is to decrease the spread of preventable diseases and to avoid another outbreak. With that bill, parents are still able to refuse the vaccination due to their children's medical conditions or religious reasons. By not vaccinating your children not only puts your child in danger, but puts others in danger as well who are not vaccinated either. We shouldn't wait until it's too late because more people can get sick. We need to make moves to encourage parents to get their children vaccinated. The importance of vaccinations need to be reinforced to parents, and they need to be encouraged. They need to be informed on the types of vaccinations their children are getting, Healthcare providers need to provide brochures for parents about autism so that they know the facts and how it is caused, so that parents are aware. Professionals should also speak to new parents about autism and vaccines so that they are getting factual information rather than information they're seeing on the internet or TV, which may not completely be true. It's good for schools to require vaccinations, and that's something that should stay to help protect all the people in the United States and everywhere else. Those who live in Sioux County can go to the Sioux County Community Health Partner site, and there they can find the times that the clinic is open for vaccinations, and there are also links to the different types of vaccinations and information about them. I've talked about today why parents refuse to vaccinate their children. I've also talked about the dangers, and I've talked about what we can do to further educate parents on vaccinations. Even though people continue to not vaccinate their children due to fear of autism, unvaccinated children poses several dangers. In conclusion, I hope you understand the misconception. Not only does vaccinating benefit your child, but it benefits other children around them who are also not vaccinated. Vaccinations are meant to protect people, not to harm, so it's important that everybody vaccinates their children, not only keep their children safe, but everyone else around them too. Here's my audience.